should note, this is medical advice. It's my own opinion. So what I say on this video, usiende substitute na advice ya daktari. You should take doctor's advice first. So I have a Q&A about endoscopy, and I will start. The first question was, should you opt for sedation during gastroscopy? One thing I'll say about this procedure, some people experience pain and discomfort. And the reason mostly for this is anxiety and some gag reflex. So the reason, or one reason that I should advise you, or you are advised at least for a little bit of sedation, is to calm you so that you can get rid of pain and discomfort. The second reason, the second question was, is heartburn same as GERD? I would say no. Heartburn cannot be the same as GERD. GERD is a disease on its own. Heartburn is a symptom. And for those who do not understand what is heartburn, it is that feeling on the chest bone where some people may feel coldness, hotness, or a burning sensation. That is what we call heartburn. When you have heartburn, it is a sign that you may be having GERD. Sawa? Yeah. That chest, that cold, hot, or a burning sensation. The next question is, should you fast before an abdominal ultrasound? I'll say it helps a little bit, but it is not a must. But this is my own advice. What your advice, at least, if maybe you're checking at the bladder, you take more water. More water is advised during the bladder ultrasound. The next question is abdominal ultrasound painful? No. How it is done, a gel-like thing is applied on your skin, then they use the probe to, the probe is the one that is used to not check your abdomen or the abdominal cavity. It is not painful, but you may feel some little bit of cold due to the gel. But it is not cold, it is just that you'll feel it's not cold. What can be seen during ultrasound, abdominal ultrasound? We'll see the liver, the gallbladder, pancreas, spleen, the kidneys. Right, comes to the stomach. No, it is not 100%. Sawa. Why colonoscopy? Reason we do colonoscopy, it is to check some polyps that are usually found in the colon. These polyps maybe in future can turn to be cancerous. That's why we do colonoscopy, so that we remove them to prevent them from being cancerous in future. When should you have a colonoscopy? When you have change in your bowel movement, maybe you used to go like 1 times 3 the number 2, or maybe you used to have maybe to go once a day. Then you notice you started if you used to maybe go once a day, you stay even a week. You see that those are some of the changes you can note in your bowel movement. Maybe if you notice you're bleeding from behind, your advice, so that maybe you can see if you have hemorrhoids and etc. That's one second reason you are advised to do a colonoscopy. If you have some digestive symptoms, maybe diarrhea from nowhere, bloating, chronic bloating, that's another reason you're advised to do a colonoscopy. The next question is gastroscopy different from endoscopy? I'll say endoscopy is a general term for those copies, but gastroscopy is an endoscopy when you're concentrating on the stomach. That is when you say gastroscopy, and you can say endogastroscopy. Endoscopy is a general term when you use a camera to check in any of your body cavity. But specifically, you have nasal endoscopy, but when you come to the stomach, it's called gastroscopy. So I've said gastroscopy is for the stomach, but endoscopy is a general term. Some people may ask, one of the muscles found in the abdominal cavity. We have transverse abdominis. That's one muscle. What is a stomach ulcer? In the stomach, we have something we call the stomach acid, which helps in digestion. Still, in the structure of your stomach, we have stomach lining. This stomach acid starts eating or corroding the stomach lining, leaving some tovidon out to those two ulcers. And this acid may penetrate even to the stomach muscles. That's why I call them stomach ulcers. It is when the stomach acid starts corroding your stomach lining, your stomach muscles. That's when you say you have a stomach ulcers. But in some situation, you'll find that the stomach acid will pass, will go deeper. Then that's when we say we have a perforated ulcer. Sawa? Hope it's clear. And that perforated ulcer is a medical emergency. So stay tuned for part 2. You can comment on the comment section if you're interested for me to do more questions about endoscopy, gastroscopy, or any type of endoscopy. So until next time, bye.